Hello, I'm Dr. Michael Harrison, a dental specialist with 40 years of experience. Today, I'll start by sharing a shocking fact. How many of you have diligently brushed your teeth 3 times a day throughout your life? Many of you might say yes. But what if I told you that this habit could actually be harming your health and shortening your lifespan? Some of you might be thinking, "No way, doctor, that can't be true." But please, bear with me and listen to what I have to say. This startling revelation comes from an uncomfortable truth I've confirmed over 40 years as a dentist, working with thousands of patients. Last month, an 83-year-old patient, Mr. James Carter, came into my office. Despite brushing faithfully 3 times a day, his teeth were loose and he suffered severe pain. The culprit? Bad brushing habits. "Dr. Harrison," he said, "I've brushed diligently my whole life. Why is this happening? My wife brushes less than I do, yet her teeth are stronger. It doesn't make sense." Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Have any of you had a similar experience, or know someone who has? I suspect many of you can relate. I meet seniors asking these questions in my office for at least 10 minutes every week. It's heartbreaking that a lifelong habit meant to help could harm your health instead. If you're watching right now, take a moment to press lightly on your gums with your finger. Does it hurt or feel uncomfortable? Do your gums seem lower, making your teeth look longer? If so, my message today is especially important for you. Stick with this video to the end, and you'll learn why brushing 3 times a day can be dangerous for people over 65, and how to keep your teeth and gums healthy without compromising your overall well-being. This one piece of knowledge could help you live healthier for 10, even 20 more years. Before we dive in, hitting the subscribe and like buttons is free. Your small gesture helps spread this vital info to more seniors. Set the notification bell too, and you'll get valuable tips for a healthy retirement first. Now, let me share 5 shocking truths about brushing that everyone over 65 needs to know, based on my 40 years as a dentist. The first bad brushing habit to avoid after 65 is overbrushing. Have you ever looked in the mirror and felt your teeth seem longer than before? It's not your teeth growing, it's your gums receding. Medically, we call this gum recession, a problem affecting about 80% of seniors over 65. Last year, a 76-year-old patient, Mr. Robert Evans, came to my office. He'd brushed meticulously 3 times a day, 5 minutes each time, for his entire life. "Dr. Harrison," he said, "you don't know how hard I've worked to keep my teeth. Brushing was the first thing I did every morning and 5 minutes after every meal. My wife always teased I'd live in the bathroom. So why are my teeth loose and sensitive?" Examining Mr. Evans, I found his gums had receded severely, exposing tooth roots. In this state, cold, hot, or even a breeze could cause pain. Research I conducted with the University of Pennsylvania Dental School found that for seniors over 65, brushing more than 3 times a day with hard pressure doubles the speed of gum recession. Why does this happen? As we age, our gums weaken compared to our younger years. By your 60s, gum tissue is about 40% thinner and less elastic than in your 20s. Scrubbing hard with a stiff toothbrush in this condition. What happens? Yes, your gums get damaged and recede further. So, are you saying I shouldn't brush? You might wonder. No, it's not about how often, it's about how you brush. One patient, 82-year-old Mrs. Emily Parker, brushed gently once a day in the morning her whole life, and her gums and teeth were remarkably healthy. What's the secret? Proper pressure and technique. Here's how seniors can brush safely. First, use an ultra-soft bristle toothbrush, about 3 times softer than standard ones, reducing gum damage. Second, don't scrub hard. Brush at a 45-degree angle in gentle circles, like cleaning an eggshell. Third, brush twice a day, no more than 2 minutes each time. Longer isn't better, despite what you might think. After 6 months of this method, Mr. Evans saw his gum bleeding stop and sensitivity drop by over 50%. You might be shocked, thinking, "I've brushed 3 times a day forever." But it's not too late. Start this method today, and you can reclaim healthy teeth and gums. The second brushing habit to avoid is choosing harsh toothpaste. What do you look for when picking toothpaste? Tartar control, whitening, cavity prevention. Big claims on the tube? I used to recommend strong effect toothpaste to patients too. But after 40 years and thousands of senior patients, I uncovered a shocking truth. Harsh toothpaste can harm aging teeth and gums. A 79-year-old patient, Mrs. Linda Thompson, used whitening toothpaste for over 20 years. Dr. Harrison, she said, white teeth look prettier, so I stuck with whitening toothpaste. TV ads show people with white teeth looking happy. She continued, it was fine at first, but as I aged, my teeth got sensitive. Cold water hurt, then even warm tea became unbearable. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Examining her, I found her tooth surfaces badly worn. Why does this happen? As we age, the hard protective layer on our teeth, called enamel, thins out. Think of it like a fruit's peel protecting the flesh. Enamel shields your teeth. By 70, this layer is 15 to 20% thinner than in your 20s, like the sole of an old shoe wearing down. Thinned enamel is more vulnerable to damage. Using toothpaste with whitening agents or abrasives, what happens? It wears down faster, causing sensitivity. A study with UCLA's dental school found that seniors over 65 using abrasive toothpaste for 2 years or more had triple the tooth sensitivity and 40% more gum inflammation. So what toothpaste should I use? You might ask. Here's the answer. First, pick a low abrasive toothpaste. Less abrasive ingredients protect weakened teeth. Second, choose one with 1,000 to 1,500 ppm fluoride. It strengthens teeth and reduces sensitivity. Third, opt for sensitive teeth formulas with ingredients to ease discomfort. How much toothpaste? A pea-sized amount is plenty. More doesn't mean better. My patient Mrs. Susan Miller switched toothpaste and saw her sensitivity halve in just 2 weeks. One small change can make a big difference. Try it today. The third habit to avoid is brushing right after eating. Brush right after meals. We've heard it since childhood. Fresh out of dental school 40 years ago, I gave that advice too. Now, I say the opposite. A 77-year-old patient, Mr. George Wilson, had brushed immediately after meals his whole life. Dr. Harrison, he said, I served 38 years in the Army. One key habit I learned was strict hygiene. I brushed within 3 minutes of every meal, never missing once. Not brushing after eating felt unbearable. He paused, sighing deeply, but now my teeth are so sensitive it's painful. I managed them my whole life. Why this? Even a sip of morning coffee hurts. His exam showed severe wear and acid erosion traces. What's going on? When we eat acidic foods, fruits, juices, sodas, our tooth surfaces soften temporarily. Brushing right then, what happens? The already weakened enamel wears away faster. A study with NYU's dental school found that seniors over 65 brushing right after acidic foods had 2.5 times more tooth erosion than those waiting 30 minutes or more. So when should I brush? You're wondering. Here's how. First, don't brush right after eating. Wait at least 30 minutes, ideally an hour. Second, rinse with water or unsweetened tea after meals to clear debris. Third, if it feels off, use a fluoride mouthwash instead of brushing. Fourth, set brushing times to morning and bedtime, not tied to meals. Fifth, after acidic foods, fruits, juices, sodas, wine, wait even longer. After 3 months of this, Mr. Wilson said his teeth felt less sensitive. Small habit changes make a big difference. Do you brush right after eating? Many of you might be nodding. Start a new habit today, and your teeth will stay healthier longer. So far, I've covered 3 brushing habits to avoid after 65. Now, let's tackle a misunderstood aspect of oral care. Dry mouth threatens your overall health. Do your lips often feel dry or thirsty? Isn't that just aging? You might think. But it's not something to brush off. Dry mouth isn't just discomfort, it can lead to serious health issues. In my 40 years, one case stands out. An 85-year-old, Mr. Thomas Davis, visited me saying his mouth was dry and food tasted off. "Dr. Harrison, is this just age? Nothing I can do, right?" But his exam revealed severe dry mouth, not just aging, 7 cavities and a fungal infection called oral candidiasis. Even more shocking, deeper tests linked his dry mouth to diabetes medication. Adjusting his meds improved it, boosting his appetite and overall condition. Why is dry mouth riskier for seniors? Saliva does more than moisten your mouth. It has antibacterial properties, controlling oral bacteria. It's key for chewing, swallowing, and starting digestion. After 65, saliva production drops 20 to 30% naturally. Add common meds, blood pressure, depression, allergy pills, and it drops further, leaving many seniors with severe dry mouth. What happens when dry mouth persists? First, cavity risk triples. Less saliva means no natural shield for teeth. Second, gum disease worsens. Saliva cleans and protects gums. Third, infection risk rises, like fungal growths. Fourth, taste loss cuts appetite, risking malnutrition. Fifth, speech and swallowing issues can isolate you socially and nutritionally. So what do I do? You're asking. Here are proven tips. First, sip water often. 8 cups a day is ideal. Second, use sugar-free candy or gum to boost saliva. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Third, try saliva substitutes. Over-the-counter artificial saliva adds moisture. Fourth, avoid alcohol-based mouthwashes. They dry you out more. Fifth, use a humidifier, especially at night if you breathe through your mouth. Sixth, review meds with your doctor. There might be less drying options. Mr. Davis, after these steps, said, "My mouth feels better, food tastes good again, and I'm smiling more." If your mouth feels dry often, don't chalk it up to age. Manage it actively for better teeth, gums, and life quality. Finally, the most critical truth. Many see oral health as just teeth and gums. But my 40 years and recent studies reveal a bombshell. Oral health directly affects heart disease, diabetes, dementia, even lifespan. Take Mr. Henry Brooks, 81. He was monitored for heart issues when his condition suddenly worsened. The cause? Severe gum infection spreading through his bloodstream to his heart. After gum treatment, his heart improved dramatically. "Dr. Harrison, teeth affecting my heart? Never heard that in my life," he marveled. Yet science backs it. Research with Columbia University found seniors over 65 with severe gum disease had a 20% higher heart disease risk and 30% higher dementia risk than those without. What does this mean? Oral health isn't just about a nice smile or easy eating. It's a key to your lifespan and quality of life. How? Gum disease lets bacteria and inflammation spread through your blood, damaging heart vessels, brain function, and worsening diabetes. A Harvard study showed seniors with healthy mouths lived 6.4 years longer on average than those without. 6.4 years is precious time. So how should seniors care for their oral health? Here's my final prescription, summing up today. First, brush twice daily with a soft bristle toothbrush for 2 minutes gently. Second, use low abrasive, sensitive teeth toothpaste, just a pea-sized amount. Third, brush 30 minutes to an hour after eating. Rinse with water before. Fourth, drink 8 cups of water daily and manage dry mouth actively. Fifth, get dental checkups every 6 months. Early detection is key. Sixth, use floss or interdental brushes to clean between teeth. Don't give up if they're loose. Mr. Brooks followed this for 2 years with no heart issues and said, "Thanks to you, Dr. Harrison, I saw my great-grandson's first birthday healthy." That's the power of these 5 truths for those over 65. I hope this helps you and your loved ones. If it did, hit subscribe and share it with seniors you know. One click could change a life. Lastly, age is just a number. With proper care and knowledge, you can keep healthy teeth and gums to 100.